Hello, I'm Zach Thomas, and I'm the Executive Director for Medical Affairs at Axsome Therapeutics. We want to thank the organizers for inviting us to present on the clinical development of AXS-05, a novel oral NMDA receptor antagonist with multimodal activity, which is being developed for the treatment of MDD. Major depressive disorder is difficult to treat, with over 60% of patients experiencing an inadequate response to first-line oral therapies. For those who do respond, it typically takes 6 to 8 weeks for them to have a clinically meaningful response. Patients have limited options for oral treatments, all of which work through monoaminergic mechanisms. A growing body of data has suggested that glutamate dysfunction plays a role in the pathophysiology of MDD, thus suggesting a role for NMDA receptor antagonism in the treatment of MDD. AXS-05, or dextromethorphan bupropion, is an oral, novel, investigational NMDA receptor antagonist with multimodal activity. The dextromethorphan component of AXS-05 is an uncompetitive antagonist of the NMDA receptor, which modulates glutamate signaling. It is also a sigma-1 receptor agonist, which modulates both glutamate and monoamine signaling. Historically, dextromethorphan has had limited utility for the treatment of CNS conditions. When given alone, it is rapidly metabolized in humans via CYP2D6, resulting in low serum concentrations, as illustrated in this figure. Bupropion, in addition to its activity at the dopamine and norepinephrine transporters, is an inhibitor of CYP2D6. This inhibition of CYP2D6 increases dextromethorphan plasma concentrations and prolongs the half-life, as illustrated in this figure. This results in therapeutically relevant plasma concentrations. NMDA receptor antagonism may result in antidepressant effects by increasing synaptic plasticity. This is thought to be mediated via either direct effects on the postsynaptic receptor or via inhibitory interneurons. AXS-05 is an oral NMDA receptor antagonist, sigma-1 receptor agonist, and norepinephrine and dopamine reuptake inhibitor being developed for MDD. The multimodal activity of AXS-05 may represent a unique therapeutic option for the treatment of MDD. Today, I'm going to walk us through the rapid efficacy of AXS-05 from 2 pivotal trials, Ascend and GEMINI. In addition, I'll be presenting a pooled analysis of the effects of AXS-05 on the individual items of the MADRS compared to control, which is placebo and bupropion. The Ascend trial was a phase 2 randomized, double-blind, active-controlled, multi-center study evaluating AXS-05 as a treatment for MDD. 80 adults with a confirmed diagnosis of moderate to severe MDD were randomized to either AXS-05 or bupropion for 6 weeks. The dose of AXS-05 was 45 milligrams of dextromethorphan and 105 milligrams of bupropion, given twice daily. The dose of the active comparator bupropion was 105 milligrams given twice daily, for a total daily dose of 210 milligrams. The GEMINI trial was a phase 3, double-blind, randomized, placebo-controlled, multi-center 6-week study. 327 adults with a confirmed diagnosis of moderate or severe MDD were randomized 1-to-1 to either AXS-05 or placebo twice daily for 6 weeks. In Ascend, the primary endpoint was the overall change from baseline in the MADRS total score, which was calculated as a change from baseline at each time point and was subsequently averaged. In the GEMINI study, the primary endpoint was the change from baseline in the MADRS total score at week 6. The eligibility criteria were similar across both studies. Key inclusion criteria included adults meeting DSM-5 criteria for MDD without psychotic features, a MADRS total score of 25 or more, and a CGI-S score of at least 4 at baseline. Across both studies and in each treatment arm, the demographics were similar and expected for patients with MDD. In both studies, the mean MADRS at baseline was in the low 30s, reflecting moderate to severe MDD. I'll now walk us through the results of the ASCEND trial. As shown on this slide, treatment with AXS-05 was associated with a rapid and substantial improvement in MADRS total score. AXS-05 achieved the primary endpoint by demonstrating a statistically significant mean reduction from baseline in the overall MADRS total score. The overall treatment effect was 13.7 points for AXS-05 compared to 8.8 points for bupropion, resulting in a p-value of less than 0.001. Looking at the change by week, we can see that at week 1, AXS-05 patients had a 7.4 point reduction in their mean MADRS score compared to a 4.5 reduction for bupropion treated patients, indicating AXS-05 rapidly reduced depressive symptoms. At week 2, treatment with AXS-05 was statistically superior to bupropion. Patients treated with AXS-05 had a mean MADRS change of 12.5 points compared to 7.8 points in bupropion-treated patients with a p-value of 0.024. At the end of the 6-week trial, AXS-05 remained superior to bupropion with a 17.2 point reduction in the MADRS score compared to a 12.1 reduction for bupropion with a p-value of 0.013. Patients treated with AXS-05 also experienced rapid and statistically significant rates of remission defined as a MADRS total score of 10 or less. 47% of patients treated with AXS-05 as compared to 16% of bupropion-treated patients achieved remission at week 6 with a p-value of 0.004. Remission rates were numerically greater with AXS-05 starting at week 1. At week 2 and every time point thereafter, AXS-05 treatment resulted in statistically significant improvements in remission. I'll now transition to the GEMINI trial. Again, looking at the week 1 changes, we can see that the antidepressant effect of AXS-05 was rapid, with a statistically significant and clinically meaningful reduction in MADRS total score compared to placebo at week 1, the earliest time point measured. After 1 week of treatment, patients treated with AXS-05 experienced a mean reduction in MADRS of 7.2 points compared to a 5-point reduction for patients treated with placebo, with a p-value of 0.007. Moving to week 2, patients receiving AXS-05 had a mean reduction of 11.1 points compared to 7.7 points, with a p-value of 0.001. Overall, treatment with AXS-05 was associated with a rapid, substantial, and statistically significant improvement in depressive symptoms. At the end of the 6-week trial, patients treated with AXS-05 had a mean reduction in MADRS total score of 16.6 points compared to 11.9 point reduction for placebo-treated patients, for a placebo-corrected difference of approximately 5 points and a p-value of 0.002. The MADRS changes at week 1 translated to clinically meaningful improvements on both clinician and global measures of depression symptom improvement, as well as statistically significant improvements on quality of life as measured by the Q-less-Q-SF. Similarly, after 2 weeks of treatment, statistically significant improvements were seen across all endpoints studied. Both patient and clinician reported global impressions, clinical remission and response, as well as quality of life and functioning as measured by the Sheehan Disability Scale. At the end of 6 weeks, the early efficacy of AXS-05 was sustained and actually improved throughout the weeks that followed. AXS-05 was safe and well tolerated in this trial. The most commonly reported AEs in the AXS-05 arm were dizziness, nausea, headache, diarrhea, somnolence, and dry mouth. The rates of discontinuation due to AEs were low in both treatment groups, 6.2% with AXS-05 and 0.6% with placebo. Treatment with AXS-05 was not associated with psychotomimetic effects, weight gain, or increased sexual dysfunction. I'll now end with our pooled analysis of the MADRS individual items. Here we pooled the results of the GEMINI and ASCEND studies to evaluate the treatment effect of AXS-05 on the individual items. Treatment with AXS-05 demonstrated statistically significant improvements on 5 items after only 1 week of treatment compared to the control group. Specifically, AXS-05 resulted in statistically significant improvements in reported sadness, inattention, inability to feel, pessimistic thoughts, and suicidal ideation. After 2 weeks, apparent sadness and concentration difficulties were also statistically improved, in addition to the sustained effects on the 5 items noted at week 1. At the end of the 6-week treatment period, AXS-05 achieved numerical improvement over control on each of the MADRS items and statistically significant improvement in 7 of the 10 items, indicating a broad antidepressant effect. In conclusion, AXS-05 is a novel oral investigational NMDA receptor antagonist with multimodal activity, representing a mechanistically novel oral approach for the treatment of depression. Treatment resulted in rapid and statistically significant improvements at weeks 1 and 2 in placebo and active control trials. Treatment also resulted in rapid and substantial and sustained improvements in depression, quality of life, and in functioning as compared to placebo in the GEMINI trial. In both studies, rapid remission from depressive symptoms was achieved by week 2 and maintained over the 6-week treatment period. Early improvements were seen across multiple MADRS items, indicating a rapid and broad antidepressant effect. AXS-05 was generally safe and well tolerated in these trials. Thank you for your time today.